My name is Joel Pomalis. I'm the founder and CEO of Mainstream Recovery. Mainstream Recovery is a consulting and training firm focused solely on recovery support services or recovery support programs. So we work with our clients to develop and implement recovery support programming. Anything from a recovery community center, peer support program, recovery high school, collegiate recovery program, recovery resident. We work with our clients to identify the need, right? What really is the need of our community and our organization, and we really tailor a program to fit the need of that community. We make sure to recruit staff, we help develop the program and policy and procedure, and we work on implementation of the program as well, implementation and sustainability to make sure that it is effective. How are we tracking? What does data look like? Is there any funding available to help the program? One of the main trainings that we offer is the Recovery Coach Academy. So we train recovery coaches, recovery specialists, peer specialists to work with people, engage individuals who are trying to enter into or sustain recovery from addiction. When working with individuals, they're not very familiar with a lot of the resources that are out there. They need help. So what treatment is available? What recovery houses are in my area? Maybe I want to move out of my area. How do I find a recovery residence or a sober home in the north part of the state or the south part of the state away from my house? How do I access social services? How do I get my license back? How do I go back to school? So we can get them connected to the recovery community, get them connected to support groups that's going to help them develop the internal and external resources and skills that they need to manage a normal life, right? We don't do it for them, but we help them become aware of the resources. It can be very difficult for anybody, even people that are familiar with it, to navigate the system. So people in the early stages of recovery are very much in need of a little bit more help than somebody else might be in accessing resources in their community. So it's very important. Recovery coaches in New Jersey are beginning to be integrated in a lot of different settings. We have recovery coaches working in police departments, in hospitals, in healthcare systems. We have recovery coaches working in treatment facilities, in community centers. We have recovery coaches working in recovery residences, recovery high schools, collegiate recovery programs, but not nearly enough. When a municipality implements a program like this, they're really able to address addiction. One of our partners had a 50% reduction in overdose deaths in their town. You cannot put a price tag on something like that, but just so important. Programs like this are in different places across the country, and we really need more of them. It's one of the most underutilized programs, but it's one of the most effective programs. Taking a little bit of work, taking a little bit of staff and resources to understand it and develop something and get it implemented is well worth the cost. The need is there. Between the amount of money saved from law enforcement and healthcare expenditures and lost productivity in the workplace alone, communities are able to save a lot of money through recovery coaching services. So we have already worked with our clients to establish a lot of these programs. We have recovery coaches working for municipalities. We have recovery coaches working in police departments, hospital systems, and we have the experience in doing that. We effectively train the people, and the communities and the organizations that implement these programs see that they work. The results are there, and we're able to do that. We want to help do that. We're extremely passionate about this work. We know that it is one of the solutions to the addiction crisis, to the opioid epidemic that we have, and having people step up is what we need to do. So us having the experience, having done this work in a lot of different settings, we just want people to understand that it's working, that it's available, that we want to help, that this will help them. A lot of people, organizations and communities don't know what to do. They don't know what's best, going off of different information, and it's important to know that this service is provided and that we have been doing it, and we've been doing it really well.